Our first speaker, Crystal Lin, will talk about fourth-year medical student radiation oncology rotations and program director.
Perfect. Thank you, guys. So, as you all know, the fourth year of medical school remains largely unstructured. So, in 2016, the LCME reported more than 30 weeks of elective times for fourth years, while both fourth-year students and their residents and program directors agreed that this time should be spent getting breadth in medicine as well as depth in the students' chosen specialty. Students who are applying in competitive specialties like RADOM often have a competing interest to perform way rotation. So, while the rest of the fourth year is being critically examined to make sure that incoming interns are meeting the competencies needed for residencies, students who are on all-way rotations are often missing out on these opportunities. So, a study from radiation oncology applicants report that on these rotations, not only are there variability in which structured didactics are available, but that performing more than one rotation does not increase a student's confidence to function as a first-year resident. Since we know that the student perspective only provides half the story, our goal was to characterize what the program director perspective was on which educational opportunities were available on fourth-year medical student rotations. So, since OA rotations are most commonly done in competitive, quote-unquote competitive specialties, we used the 2017 match data to isolate all specialties in which there were more applicants than residency positions available. And then we excluded combined preliminary year and positional year programs, leaving us with these 9 specialties. We're here today because radiation oncology is on here, right? So then, based on a literature search and input from the investigators, we developed a 6-part survey, REDCap. We then pilot tested our survey with the University of Chicago program directors in the specialties that I just listed, as well as an expert in medical education. And in particular, our survey was focused on applicant selection criteria, as well as characteristics of a medical student rotation in fourth year. So using the AMA's FRIDA database, we distributed our survey to 866 residency programs. 125 PDs completed the survey, giving us a response rate of about 14.5%. Unfortunately, we didn't have any survey incentive, like $15 to help out with the process. But as you can see in RADOM, the response rate is about that of the overall group. So while we understand this survey response is low, and therefore it might be hard to generalize the data, we did think that the results are interesting and could be hypothesis generating for the future. So kind of for the rest of the talk, I'll be presenting the results from the radiation oncology portion of the data set. But also, there are bonus slides at the end for anyone who might be interested in seeing how the RADOM data compared to all those other specialties. All right, let's do it. So with the radiation oncology data, 3/4 of our respondents were male, and the median age group was in the 41 to 45 years old range. In addition to being the program director, about half of them were also the clerkship director for radiation oncology. 8% reported a formal degree in medical education, while more than half had some experience in seminars or workshops. And then for the programs represented, vast majority of them were university-based hospital systems, and the median program size was 8 residents. So then we wanted to know about their applicants. So PDs reported that their applicants completed a median of 3 rotations in radiation oncology in their fourth year of medical school. So for most students, that broke down to 1 sub-I, as well as 2 away rotations. Since that comes out to about 3 months of the fourth year time, we really wanted to know what education students were receiving while they were on these rotations for 3 months. So when we asked, we found that the most common educational activity during this time was student presentation department, which you can see every single program reported. And from our perspective, it's interesting to see because we would consider that more of a component of an audition rather than an experience for education. And something more basic like lectures, 62% of programs had. And which is interesting because on the flip side of that, that means about 1/3 of programs didn't have a single lecture geared toward medical students in a month-long rotation. Right? As you kind of go along the rest of this list, there's even less opportunities for those types of education. Then we asked the program directors if they believed that rotation grades on these radiation oncology rotations were indicative of student performance. And as you can see here, there's not really a consensus. So for the PDs who reported never or rarely were these grades indicative, they cited that many students received mostly honors or A's, or that grades were reported as pass-fail. Additionally, there was a sense that students rotated too rapidly between attendings to get a full grade. On the flip side, PDs who reported often or always said that they believed that the month-long rotation was sufficient time to provide insight into a student's abilities. So with limited educational content on these rotations and no quite consensus on the valuable, if grades were valuable, we also asked the program directors to rate on a scale from an opportunity for familiarization, so like an audition, or an educational experience, what they believe to be the primary goal of this fourth-year rotations. So all the data is up here. You can see that in radiation oncology, the mean of what the program directors reported tended to lean towards an educational experience, but the yellowish orange dots are the individual responses, and there's pretty much a wide range across the board, meaning that there's definitely still some component of an audition happening on these rotations. We thought what was more interesting was that if you look across the different specialties, there are some specialties that tend to lean more towards an audition, such as neurosurgery, orthopedics, ENT, and plastics, whereas other specialties, such as dermatology, IR, vascular and thoracic surgery, tended to lean more towards an educational experience. And this data kind of made us wonder about, what is the culture of a specialty, and does that influence kind of the culture of these rotations, and if they tend to be more educational or more audition. So we also asked program directors what percentage of their applicants had completed an rotation at their institution prior to applying. As you can see in radiation oncology, about 1 in 5 of their interviewed applicants and twice as many of their matched applicants had previously completed a rotation with them. While this result isn't statistically significant, it did definitely trend towards what we were seeing in the overall data, that matched students were completing rotations at higher rates than interviewed students. Finally, we wanted to know what barriers there were to providing education on these rotations. When we asked the program directors, we had them rate the availability of these resources on a Likert type scale from never available to almost always available. So as you can see up here, residents and teaching faculty were almost always available, but protected time for faculty and financial resources were much more of a barrier. Given that resources do pose a challenge, we believe that these data support the idea that having collaboration between institutions or even having support from a national level organization would allow schools to pool their resources and therefore be able to provide education for their students. Of course, our study has several limitations. As mentioned before, we did have a low response rate, so given that we had no survey incentive, we believe that we may have oversampled program directors who might be interested in this type of education or this type of research. Additionally, there'll be some element of recall bias since we did ask them to estimate numerical responses. And finally, since it is a survey, there will be some element of social desirability bias, or the idea that respondents are more likely to report socially desirable answers. So overall, we've characterized the fourth-year medical student rotation as potentially audition-focused, limited in structural education, and resource-constrained. However, in radiation oncology and several other specialties, they're quite prevalent. So since students are doing rotations at such high rates, we believe that a collaboration between institutions to provide some sort of structured curriculum will allow the students to make the most of that time and making sure that they're building the foundational knowledge that they need for residency and really making the most of their last year of medical school. So I'd like to thank Dr. Golden, who's my mentor on this project, as well as Dr. Ballack, who's a program director in orthopedics, as well as the other program directors we've worked with and other leaders in medical education. So with that, I'm happy to take any questions.